So we have a little bit of a kind of break from presentations. We're going to have a kind of informal discussion. How this is going to work is that, sorry, I don't have my right thing open here. I'm going to moderate some questions between Dr. Bossé, Dr. Miriam Soleimani, and Nikki Harder. So I'm just going to read a little bit of a bio for Dr. Bossé and Nikki Harder. And then Dr. Miriam Soleimani is going to show us a small presentation on the VHL consortium, and we'll get started on questions. So Dr. Bossé is a medical oncologist who specializes in genitourinary cancers. He completed his medical school, Master in Physiology and Biophysics and Internal Medicine training at the Université de Sherbrooke in Quebec. He completed his medical oncology residency training program at the University of Ottawa in 2016, followed by a clinical research fellowship at Dana-Farber Cancer Institute in Boston. Dr. Bossé also completed a master's in public health at the Harvard T.H. Chan School of Public Health. He currently practices at the Ottawa Hospital Cancer Centre in Ontario, Canada. And then I'm very proud to introduce my friend and colleague, Nikki Harder. She is a mother, partner, friend, cooking enthusiast, reader, a goat herd keeper, and a VHL warrior. She lives in British Columbia with her son, also a VHL warrior, and her partner. She worked as a child and youth care worker for 15 years and has a BA in child and youth care from University of the Fraser Valley. She has navigated the ups and downs of Canadian healthcare, had multiple serious surgeries because of her VHL, and even lost loved ones to VHL. She is passionate about helping others, and especially those in our VHL community. So, Dr. Soleimani.
Thanks so much. We figured that a lot of you have questions, patients and caregivers in the audience about how to access VHL care, and also for the healthcare providers who are joining us today, how you can join our network that we're developing across the country, especially in this era now with belzutifan. Management of VHL is much more nuanced. It's always been a disease that is very multidisciplinary. You need experts from all areas that are involved in the care of VHL to work together. We have a lot of guidelines on how to manage, areas of disease in VHL, but guidelines have to be followed. And we don't actually have Canadian data that tells us how adequately we follow guidelines. And I don't have to tell any of you who are patients and caregivers in the audience that the care of patients with VHL is quite fractured in Canada. And there's a lot of variability across the country. Without doubt, there is delays in access to care. There can be both over and under treatment. And the care is often managed in silos. So, someone may feel comfortable managing one aspect, one area of disease, but not others. And now with belzutifan, there's an added layer of complexity in terms of awareness and comfort with prescribing it. And patients really have to do a lot of self-directed care and self-advocacy. I know patients have told me, I no longer have a family doctor. So I had to go to a walk-in clinic and show them the VHL guidelines and say, I need an MRI. Can you please order me an MRI? So we got to do better than that. And, the issue that comes about is that when we are not adhering to guidelines, when we don't have good standard of care practice, what we're doing is very reactively managing the disease. We see a spot, now it's there, we need to deal with it. Perhaps it's big and we have to rush to make an urgent decision about surgery, as opposed to being proactive and watching things carefully and, coming up with nuanced plans. So how can we improve on this? A lot of this in rare diseases comes down to developing care networks and clinical care pathways where you can really have a more holistic approach to care delivery, coordinating care, allowing us to improve clinical outcomes. And at the same time, when we connect all of us together in this way, it allows us to do a lot more research and innovation. And in other areas of oncology, we have seen how successful this can be, where if patients are managed at centers that have expertise, they have better outcomes. We can also reach patients in areas that we otherwise wouldn't be able to. We can reach patients in minority populations, BIPOC patients, patients with socioeconomic challenges. So it allows us to also improve equitable access to care. And it's important because in addition to that, it allows us to sort of refine how we treat patients and to support each other. So no one member of the healthcare system feels they're kind of, having to do it on their own. So we can improve outcomes, we can reduce costs to patients and to the healthcare system, address healthcare disparities. And there has been research that has shown that centralizing and coordinating care does improve patient outcomes. And a lot of the research that's been done has actually, patients have expressed that this is a high priority for them. So what are other parts of the world doing? It's really quite variable. So in Europe, they do have sort of networks online where cases can be discussed in sort of an anonymized way to get advice from others in terms of management, to understand how to access drug. And there's also the Rare Kidney Disease Reference Network in the UK, where you can look on there, in my country, where are the clinics where I can refer my patients. In the US, as I'm sure many of you are aware, the VHL Alliance, which is sort of based in the US, but is an international organization, does a lot of great work, and they have a list of clinical care centers that you can find on there as well, mainly in the US. They have very specific criteria to become a clinical care center on there in terms of the types of services that the institution provides across the spectrum, from the types of specialists to the types of scans that can be done to the types of treatment modalities available. So in Canada, we have some unique challenges when it comes to these things. There's disease factors. VHL is very heterogeneous, and presentations can be very variable, and experience is important, and you need longitudinal care. And what I mean by that is you really have to follow a patient through their journey for a long time to understand the disease and to know how best to help them. There's geographic factors because we're a huge country, and there's regional considerations. Healthcare authorities are different from province to province, and sometimes even within a province. And there's systems factors, creating roles like nurse navigators and care coordinators and establishing clinics like this. It requires funding. And as we hear very regularly on the news, there are always challenges within the healthcare system. But I personally do believe that it is possible in Canada. Much of oncology care is run through sort of provincial and regional programs. We've seen this done in sarcoma care, and I think we can do it in Canada. And it's unique. So, what works in BC may not be what needs to happen in Manitoba, may not be possible to happen in the Maritimes, for example. So it's not a one-size-fits-all approach. It may look different in different places, but the point is that we have a network. So when Anna, who is on the call today, our clinic nurse navigator here in Vancouver for the province of BC, when she and I started up our VHL clinic, we reached out to these wonderful folks, and you see Dr. Johnson is our endocrinologist expert in our clinic, and said to them, we want to start up a clinical program here. Would you come on board to support us in the care of these patients? And Anna and I sort of quarterback it, and we communicate with these folks depending on what a patient's needs are. We're now expanding that network to develop pediatric oncology pathways so that children, when they age out of the pediatric, the BC Children's system can then transition into our clinic very smoothly. And we know that it's very important to address the psychosocial needs of patients. So we're recruiting our patient and family counseling services as well to come on board. The goals of this Canadian sort of consortium that we're working to develop in BC, our goal is to coordinate care and centralize it for patients in BC. But we want to hopefully help support the development of similar clinics, at least one in each province, and to really improve care delivery in Canada, to also collaborate with organizations like Kidney Cancer Canada, the VHL Alliance. Obviously, we work very closely with CVHLA, and then to really advance research and innovation, and bring more trials to patients with VHL, and also look at our own outcomes with belzutifan in the real world. So our clinic looks after the full sort of spectrum of needs of patients, from the surveillance to treatment and referrals, fertility assessments and planning referrals. And we're constantly sort of evaluating and asking patients, what other ways do you think we can help? And this was a study that was done in Europe where they looked at the criteria for VHL care from the patient perspective. And patients said that, they really would prefer care in VHL expertise centers and to have integrated VHL specific pathways. So to get there, I have been sort of soliciting my colleagues across the country to say, let's build a Canadian VHL clinical and research consortium and have sort of a network of multidisciplinary experts across the country and clinical care centers across the country. And as you'll hear in a moment, Dr. Bossé answered my call and has been doing some amazing work in Ottawa, and I'm really excited about that. I think there's lots of research opportunities we can also bring about to advance and really be leaders in Canada and VHL. So we have our clinic in Vancouver, as I mentioned. We're in talks in terms of developing a sort of network in Winnipeg. Toronto, we are in talks with some folks at Sunnybrook to help sort of support the development of a clinic. Ottawa, you will hear from Dr. Bossé in a moment, and also in talks to help support the development in Quebec City. And I should update this to also add Montreal. At McGill University, they do have a similar sort of setup to what we have in Vancouver, led by a geneticist with a team, sort of like I described. So I just wanted to present those slides to put it into context, and then I will pass it over to our panelists to kind of share what everyone's been working on.
Wonderful. That was a great presentation. Lofty, lofty goals, but I agree we can get there. Dr. Bossé, was there anything you wanted to say before I had some questions?
No, if it's just not to raise my hat to the Miriam that's been showing an incredible leadership in the country and very inspiring always to hear talking. And I think is an easy call to answer. Like being also a kidney cancer expert like Miriam is. I was excited to see the data about belzutifan, but one of the huge challenge was, where am I going to find these patients? Because there are far and few in between. But it's by doing the work like Miriam did to call out and ask and networking that we find these patients. So we've done the same in Ottawa after following the traces of the example of BC, and then we've been asking. I've been talking with my ophthalmologist, for instance, my geneticist, with my endocrinologists, and with patients themselves. And I've been finding way more patients than initially we thought we had in our region. We know it's 1 out of like 36,000 people, but truly, I don't know that we know the exact number, but that's the number we work from. And sometimes, there's some champions that, or champions of people that have more manifestation of the disease that, the healthcare system is aware of. But there's those who did not need the healthcare system just yet, that do have VHL, that may know it or not, but so far they're probably not managed or follow, carefully. So I think on top of building that team in Ottawa, we're trying to do a lot is engage patient. I ask each patient, if you talk, to people, member of your family, extended family, or of other people through the forum you've been on, like VHL.org, or other conferences that you're trying to access care in the region of Ontario. I can see them from anywhere through Zoom, or come to, if they're close to Ottawa, usually come to my clinic, or on the west side of Quebec, this Gatineau's huge region just across the river. I'm willing to see those people. And as a matter of fact, we're seeing a constant flow of referrals so far. And that has allowed to build that clinic, because the problem is that if there's one patient, for instance, it's difficult to build a flow of action. But when you have the whole picture, when you have most of the patient under your umbrella, like Marian does, then it becomes easier to engage also champions, right? Because there's a volume of patient, there's possibility to build an expertise, to have enough patients so that they too feel confident. So really, this is where we're at. We've been working on it on our clinic for still young, maybe less than 6 months, but we've managed pretty well, and now we have graft VHL nurse to this clinic, so that's going to facilitate even further and bring a different aspect to the clinic, a different vision to it. And we have also many surgeons that answer the call, and we're ready to funnel the patient, receive the patient if they're funneled to them. So it's been working great, and it's very exciting to meet VHL patient and to discuss belzutifan, access to care. And to my surprise, a lot of patients actually did manage pretty well to get their follow-up done. So that's a good thing. But they're still very excited about this clinic because of their children. And they wonder how that transition will happen between the pediatric system to the adult system, and how they're going to manage to fight the system, because that's the system we need to fight, I guess, to get the proper expert in their care. And that VHL clinic comes and fix this problem, because transition will go from the pediatric ward to this clinic, and then we'll reach out to our champion to make sure that the transition in the adult system in a seamless way. So that reduces a lot of stress, I find, on the shoulder of these young parents.
Wow, so it sounds like there's a lot of networking, chatting with other disciplines and other healthcare professionals, a lot of networking, trying to find VHL patients. It sounds like there's a lot of work that goes into setting up a clinic. For anybody who's on the call who might be interested in setting up their own clinics, are there any tips and tricks that you can share in setting up a clinic? And, what were the barriers that you're finding that were either insurmountable or very difficult to overcome?
So what I did when I was first setting up the clinic, and the way it started was I saw one patient with VHL, and it was immediately obvious to me how fractured the care of patients was. And I had a discussion with this patient who had been actually going down to a clinic in the US for their surveillance. And I said, why do you have to go down to the US to get MRIs and pay for them? Let's set one up clinic up here. Why have we not done this? And it really started from that. And I didn't know what to expect in terms of patient numbers, like Dr. Bossé said. So I actually first touched base with our hereditary cancer program to get a sense of the numbers of patients. But as you may know, VHL is a clinical diagnosis. Genetic testing is very important, and patients should have that, but many don't, especially those who have a clear family history. So they don't necessarily capture everyone. But it gave us a bit of a starting point, and they very supportive of getting the clinic going. And then I spoke with Anna, and we sort of decided to put the clinic together. So I think where you are, first getting in touch with your cancer genetics program is a great place to start, sort of as a starting point to get a bit of sense of numbers, and to get a sense of sort of what is currently happening in your jurisdiction. There's always challenges. Our clinic functions as a network. To have a multidisciplinary clinic where you have all of these experts in one room at one time, it's completely impossible these days. Schedules don't permit it, space does not permit it. And I would argue it's actually not necessary. We have technology these days that allow us to communicate efficiently. But the challenge is always time. Time is perhaps our most precious resource. And how do we integrate this into already very busy practices? And how do we sort of get buy-in from our leaderships of our organization I presented the concept that I had to our leadership, and I said, for now, I'm not asking for any specific funding. I'm going to integrate this into my practice and see how things go. We're now almost not quite 2 years into having a clinic here, so I'm going to go back to them now with a sense of numbers of patients. We have 60 patients or so in our clinic in BC now. Give them a sense of sort of where things are going and to build it up. So I think you can start in small steps, just build that network of experts where they have the niche, as Dr. Bossé was saying, they know how to deal with the disease, they know the disease, and then you can slowly build it up over time. If you're waiting, to say, I want funding and I want established time and I want this and that, it's going to take a long time. Frankly, in the healthcare system, these things take a long time. But I think starting in baby steps and building it up works really well. And then getting the word out to patients so that they know, often just through word of mouth, patients will hear, but getting the word out about who's eligible to be referred, and the process in and of itself also takes some effort.
Yeah, I think if you don't ask, you don't know. But when they're asking, you start hearing, oh, yes, I do have 1 or 2 patients. And then they ask colleagues and everybody has 1 or 2 patients. And then you just go around specialties like that. I find ophthalmology is particularly ideal because patients are very quickly symptomatic from a angioblastoma on their retina, whereas they may not be from a phaeom, they may not be from a small renal mass, right? So they will consult ophthalmology because their vision has changed. And so they're receiving some form of laser and things like that. They may be candidate for belzutifan, and that would improve the care of their eyes as well, right? So engaging ophthalmology and teaching them about hey, this patient may or may not be candidate also to receive belzutifan, which could help. So they're very the ophthalmologists are very excited about that, and so the patient obviously. And I think also the pediatric hospital is very helpful because they are usually very well organized in terms of following up a young patient, the children. Thanks God, they are. But endocrinology is very involved, and so in speaking with pediatric endocrinologists, it's often where you can see and find the families, and then you can just work your way up actually from this. These contacts, and the pediatricians are also excited because then they know somebody will be taking over, right? And then they can tell you who they've been referring this patient to when they were graduating before the VHL clinic, and then you can email this patient again, and all of a sudden you can trace them like this. And for region where you think there's 2 patients, then you find out all of a sudden a dozen, right? So yeah, that would be my trick in terms of I did the same as Dr. Soleimani. I just add those patients to my clinic. It's a small number. It's a very rewarding, population of patients because it's exciting to be able to offer good solutions. So for me, it's been very positive, and it hasn't been too much of too much difficult to integrate. But we're trying to plan for the future when there's going to be more patients. I'd like to separate them a little bit from my cancer clinic so that they get their own slot in my clinic so that they can sit together, if you want, in the waiting room, as opposed to be feeling that they're visiting the cancer center because they don't have an active cancer. Most of them do not. So I'm trying to do that. And with the help of a nurse, a VHL nurse, that's going to be more and more doable. And to scale it up, we'll be looking potentially to adding different type of patient to this clinic, like lymphomany, who share lots of the challenges that VHL clinic do have. And so by building like this, we're going to have a if you want, a cancer genetic, sort of program under which there's going to be different track, including VHL and others that, live through similar uncertainty or have the same unmet need, if you will. Minus the access to belzutifan, obviously, which is very unique to VHL patients.
I'd really like to hear from you, Nikki. What has been your experience accessing a VHL clinic, like the first of its kind after going years and years of, talking to this person and even educating physicians probably about VHL, what's that like? And then I'd like to hear from Dr. Soleimani and Dr. Bosse. What are you actually seeing are like concrete examples of your clinics benefiting VHL patients?
So the clinic's really changed my life for just like so many things, so much for the better. Before I went to the clinic, I was actually looking at like a second brain surgery within the year, and nobody was listening to me. I actually ended up in the ER to try to get an MRI, and the nurse thought I was like losing my mind because I was like, well, I have a brain tumor. And she was like, okay, yeah, I'm sure you do. And, she had to look up VHL, and it's constantly talking and screaming and crying and not being heard. And like now I feel heard, I feel validated, I feel seen. I have this hope that I never had before. Like, I lost my mom many years ago, and I think my hope kind of went away with that, and our medical system didn't help bring it back. But Dr. Soleimani and her team have really just given me power, and they've given me control. And these are all things you feel like you lose when you have VHL and you are just kind of bumped around to person who just kind of like look at a chart and write things down and say, okay, you're getting in for surgery in 2 weeks. See you then. So that's just had a trickle down effect on my entire life, like my family, my relationships. It's just brought things together in this way I never thought was possible. And it's, it seems like such a small thing, but it's changed everything for us.
Yeah, I think having a plan, as you say, like a place to call home, like, when there's VHL problem and you go there and you're not going to teach the physician what VHL is about. It's definitely one of the benefits I've seen in my clinic. My patient did very well at finding the test they needed. They're happy to walk in this clinic where they don't have to explain anything, that they know they can discuss Balzotafan. That breaks the silos also that Dr. Soleimani has been talking about, the silo of care. So they know that it's more kind of a quarterback in this clinic where we're going to, consult with all of the experts, so they don't have to, go around, as opposed to go to us and then we take on us to actually loop in the right person. So that's another benefit. And one of the greatest benefit on top of getting access to Belzutifen is needed, I think, is really this landing zone, this landing clinics for the children that, relieves the young parents. I think it's been a recurrent comment in my clinic that they were really happy because they were stressed about their children graduating the pediatric care to the adult care system. That is the name, obviously.
Yeah, I would agree with that. As a parent, I have an 8-year-old son who also has VHL, and just knowing that there's a future for his treatment. It's not going to be like my mom or myself, where it's, been very makeshift. Like we're only getting bigger and better. Like we can only go up from here, thanks to you guys. And just knowing that for my son gives me so much relief, because seeing your child suffer is the worst thing you can imagine. But knowing that he's going to suffer less and have people in his court it changes a lot as a parent.
Yeah, I would say, we've had very practical, positive outcomes. So through the clinic here, there were patients who were sort of being considered for surgeries and were referred, and we have been able to avoid quite a few nephrectomies. We've been able to avoid 2 Whipple procedures for pancreatic disease. We've been able to avoid about 3 or 4 neurosurgeries that would otherwise have happened, and even radiation, which is even worse for brain disease. So there are practical positive outcomes we've seen. We're doing a study now to look at how, since the initiation of the clinic, there have been improvements in adherence to surveillance guidelines, to sort of see whether we are doing a better job than before. So practically, we've seen a lot of improvement. And I remember I got a call from an ophthalmologist. It was probably like 3 months into starting our clinic here. And I got a call from this ophthalmologist, and he said, "What is this drug that you put this patient on? All of the retinal hemangioblastomas are gone." And, he said, tell me more about this drug. What is it and how does it work so fast? I saw the patient 2 weeks after they started the drug and it's improving so dramatically. And we built that connection. And that's someone that I may never have crossed paths with otherwise. And so now we have a collaboration. We are just about to submit a manuscript where we've looked at eye outcomes with belzutifan in our population, which is the biggest sort of study with largest number of patients to date. So it's been really positive for collaboration, for patient outcomes. And for me, I think Dr. Bose can agree with this. Being an oncologist is an incredible privilege, and it's a really humbling profession. And we do not take that lightly. For people to trust us with their lives is tremendous. And I think, to look after patients who have had to do so much advocacy for themselves and who are so motivated, it's really inspiring. And hats off to all of you who've been doing the work for years and years and years before all of this. Thank you for entrusting us with that. And in our clinic, now Nikki's taking on a bigger role as a patient representative to let us know how well our clinic's working, what we need to improve on, what additional services we need. We have projects coming up and grants we've applied for more research, and we're going to have sort of studies, and we want to get patient input on whether they think the studies are valuable. So there's so many opportunities, and this program has inspired others to start similar initiatives in other rare diseases. And CORD is sort of using this as an example of what can happen with the recent commitment from the federal government for a fund for rare disease drug development. So, we always want more folks involved, and through the CVHLA and through others. So, yeah, it's wonderful. There are a few questions here. There was a question about access to belzutifan, and I want to make sure to address it because it's very timely. We found out yesterday that the manufacturer Merck will be closing the compassionate access program for belzutifan for VHL disease as of September 1. So patients who are already enrolled in the program will continue to receive medication, and any patients enrolled until September 1 will continue to do so. So we have been working feverishly since we heard this news through the Medical Advisory Council. And I know the CVHLA is working with Kidney Cancer Canada as well to, appeal to Merck to reconsider this. I am hopeful and optimistic that eventually belzutifan will be funded and will be available sort of through provincial health plans. But this does mean that there may be a bit of a gap in access to it. We're going to really try very, very hard to advocate to prevent that gap from happening. But I saw there was another question around that. So please stay tuned. We're going to keep you abreast of any developments. We've expressed our disappointment with this decision, and we're going to try and see what we can do to reverse it.
Thank you, Dr. Soleimani. Just a notice on time. I know this is our break time. I propose that we're going to break from the hour. So for me, that's going to be 3. For some of you, that's 2, and trickles across the province. And then we'll hopefully reconvene at 10 after the hour. So just maybe last 2 questions. One is for Nikki. As a patient, what support service for patients or change in a care path would best support a VHL patient?
I think having an approach, a biopsychosocial approach, it needs to kind of encompass everything that we encompass, right? This disease affects so many different parts of our bodies. So to have people who talk to each other is huge for me, but also having a mental health aspect to it. Having a chronic illness that kind of affects you throughout your life, affects your family members, it's traumatic, right? And we know trauma affects the body in a lot of ways. And I'm super curious to know if it actually affects the manifestation of our tumors. But, it encompasses things like grief for lost loved ones, but grief for, the life you're not going to live that's typical, or, your loss of abilities, your loss of your child growing up in a certain way, trickles down into your relationship. So I think a huge focus on the mental health aspect could really change the approach in so many ways. And Dr. Soleimani is obviously working on that, but just for me, knowing that the trauma is going to affect me in so many ways. I would really just love to have somebody in my court to do that too.
That's wonderful. And maybe one last question. There was a question in the chat, and it is, how do we access these clinics? How do we get to you, Dr. Soleimani? How do we get to you, Dr. Bossé?
So to get to me, all that needs to happen. So our clinic is for patients all throughout BC. I also see patients from Alberta. So a general BC Cancer referral form is sent. And if you just Google BC Cancer referral, any healthcare provider who's involved in your care can fill that out. And in the reason for referral, they just write VHL clinic. And our clerks have had training. They know exactly how to triage those referrals. And we get patients booked in usually within a month to be seen. So it's as straightforward as that. If you have challenges or you're not sure, please contact the CVHLA and they can help you sort of navigate that. And I'll let Dr. Bossé sort of mention how to navigate Ottawa as well.
Yeah, unfortunately or fortunately, I'm not sure that, in Canada, most of the provinces, specialists only see patient referred by, another physician. And that's sort of a bit of like a bylaw thing. As opposed to the US, you can just call a specialist, say, I want to be your patient. I want to see you now. And you just drop by. And that's so empowering. I've lived in Boston a little bit. So I have my, bad idea about the US system, but then I saw also some great things, and certainly it does empower the patient a lot. For me, it's the same as Dr. Soleimani. It's just a consultation, VHL clinic at the cancer center. And then the only place treating cancer in the whole Eastern Ontario, like from Kingston to Gatineau, it's just Ottawa. So it's going to have to go to me. There's 3 triage nurses. They know me. They talk to me every day, and they know about the VHL clinic. They book patients very quickly. I also put my email address there because ultimately I'm not going to let like a referral pattern, be in my way. I'll find, just email me. I'm going to sort it out. If it's not working, I can see you with or without a consultation. It's not the routine way, but we'll find, it's not the barrier there. So shoot me an email, and then I'm going to forward it to my registration. And we'll find a way to get you in. That's the most important thing. And then referral comes in second. You know what I mean? So, you can share my email with other VHL patients that are in my region that Ottawa makes the more sense for them, either Gatineau, Ottawa, Kingston. I'm more than happy to see everyone. I do Zoom, phone, or in person. So I will try to. This clinic is all about taking barrier down, right? So I think it starts with the referral, and then taking every other barrier down, for images, for testing, for referral to other subspecialists, surgeons and whatnot. So yeah, it's all about barrier down. So just email me, we'll sort it out.
Yeah, CVHLA has a list of our contacts. So if you're ever trying to figure out how do I go there? Who do I see? Is there a clinic in my province, or who in my province can I see? Please reach out to CVHLA, and we try to make sure the information's updated, and then we kind of help guide you through how to get the referral in. So
absolutely. I do think that things are moving so quickly in the VHL world. Even since the inception of Belzutifan in Canada in 2021, that we are trying our best to keep up. We're going to have a new website, and there'll be a lot of this information on there. Some of it is confidential because, Dr. Bossé, you sound like my hero. Thank you so much for breaking down those barriers. That's huge, the referral process. But there are some physicians who may not be willing to do that. Some of them need to follow the process in order to get paid for the wonderful work they do, and that is well deserved. So feel free to reach out to the CVHLA at any time to, we'll get in contact, or we'll give your email to that physician, or, we'll figure it out. And we're building it as we go, and we would love feedback. So at the end of this entire session, there's going to be a feedback survey. And if you want to fill out some of your comments in there, we will take them very seriously. So I think we'll do one more minute, and then we'll go for a 15-minute break. Dr. Bossé, Dr. Soleimani, Nikki, is there any last parting words you'd like to say?
I just like to say thank you. Like, I don't know, I raise my hands to all of you in the community who have really just given us a voice when we felt like we don't have one. I know I'm not alone in struggling with the Canadian healthcare system, but I can't describe how much this has changed my life in so many good ways and given me so much, I just want to do more. I want to be an advocate for not only myself, but those in the community. And just thank you for all of that.
Yeah, and thank you guys for inspiring us. Thank you for supporting us in this. We have some really exciting events coming up in 2025 with the CVHLA, and so stay tuned to hear about all of that. It's going to be a really great time. There's lots happening right now, so thank you all so much for the advocacy that you do. It's really important. Please always know that the patient voice is tremendously powerful. Feel empowered by that. Know that we support you, and never be shy to reach out. We're here for you guys.
100%. Like patient advocacy is the biggest tailwind that we can have, both from a motivational standpoint, but also from a political standpoint, from a economical standpoint, and many other standpoint. Because physician will always say surgeon, so the so the politicians disregard us. But when patients are voicing it, then they understand that it's important, and your voice carry much more than you think. So continue doing the extraordinary work you guys are doing at CVHL, but also individually in your own community, in your own forum, with your own connections.
Wonderful. Well, thank you so much for this wonderful discussion. The amount of hearts that were appearing across the screen here and the comments that are in the Q&A, please feel free to read them. We're touching a lot of lives for sure.